Hi, everyone. So the first biomedical therapy psychotropic medication we're going to talk about are antipsychotic medications. This will cover pages 575 to 577. So what are the psychotropics? Well, they're prescription drugs that are used to reduce psychotic symptoms. So in other words, they're typically used to treat schizophrenia. We're going to talk about other uses later. They might also be called neuroleptics. That's another name for them, but those are what antipsychotics are. So when we talk about it, we're going to start 2,000 years ago because that is actually when snake root was discovered. So in India, this herb derived from snake root was discovered to actually be able to treat psychotic symptoms associated with schizophrenia. Now, it's things like hallucinations, delusions, and distorted thought processes that the snake root was found to be helpful for. That same herb was also being used at the same time in traditional Japanese medicine in order to treat things like anxiety or restlessness. Eventually, when they started realizing it had many wonderful properties, including being able to treat high blood pressure, they actually turned this into a drug. And the drug is reserpine. And reserpine has been found to be beneficial in treating schizophrenia. Then you have chlorpromazine. So in the 1950s, French scientists started looking into the psychoactive properties of another drug. Chlorpromazine works pretty much the same way as Respirine. It diminishes the psychotic symptoms that you see in schizophrenia. Because of that, they decided to call these antipsychotic medications. They discovered chlorpromazine has fewer side effects, so it actually became the preferred medication. Now, you've probably heard of it as Thorazine. Thorazine is still used today to treat psychotic symptoms. Well, reserpine and chlorpromazine both act differently on the brain. They both reduce the levels of dopamine. So, since their development, there have actually been 30 other antipsychotic medications that have been developed. And these all work on the positive symptoms, like the hallucinations, the delusions, the distorted thinking. And because it worked on all of those things, it actually reduced the number of people that ended up hospitalized for schizophrenia because they no longer had all those delusions and they were no longer hallucinating and hearing things. They could actually be released and live in society. Up until the 1950s, if a person was diagnosed with schizophrenia, that person was thought to be uncurable and pretty much untreatable. Most of them were just hospitalized. They were placed into a mental institution and left there the rest of their lives. With this introduction of antipsychotic medications, though, the number of patients that ended up in mental hospitals actually decreased dramatically around most of the world. An important note, in some parts of the world, they don't have regular access to the antipsychotic medications. As a result, there's actually some pretty antiquated treatments, is how your book worded it. Barbaric treatments, some inhumane treatments. For example, person who is currently psychotic might be just chained to the wall so that the person can't do anything to hurt himself, herself, or anybody else. Those things continue in a lot of places because they don't have those access to the antipsychotics. All right, so antipsychotics are not completely without their issues. So although these early antipsychotics have helped thousands of patients be discharged from hospitals and get to live lives, they're not without their drawbacks, unfortunately. First of all, they don't actually cure the schizophrenia. The person has to be taking the medication for those symptoms to not be present, for those symptoms to be gone. The problem is, as soon as the person stops taking the medication, the symptoms can start to return, and they may end up, people think they're taking their medication, they may not realize they're having delusions or hallucinations, and they can become dangerous to themselves or others. These medications are also not really beneficial for the negative symptoms. When we talked about schizophrenia, we talked about social withdrawal, apathy, lack of emotional expressiveness, and in some cases, um, these antipsychotics are actually making all of that even worse. So that was another issue with these first antipsychotics. There's also side effects. With any medication, there's a side effect. And with this one, it's things like dry mouth, weight gain, constipation, sleepiness, poor concentration. And the other issue is that they lowered the levels of dopamine throughout the whole body. And dopamine is actually involved in normal motor movements. So this alteration can cause problems with things like muscle tremors can occur, rigid movements, a shifting gait, mask-like facial expression. Um, the long-term use of these antipsychotics actually caused a small percentage of people to develop this disorder that's called tardive dyskinesia. And tardive dyskinesia is characterized by severe uncontrollable facial tics, and like grimaces, chewing movements, or other involuntary movements of the lips, the jaw, or the tongue. Oftentimes, this cannot be reversed. So people would take this and then have these issues later on. Another big drawback. Once a person's stabilized, the person might be back in the community and then just stop taking the medication and be like, okay, yep, I'm fine, and stop. And then they end up rehospitalized. So they end up going back to where they were and they're back into the mental hospital being treated once again. So, important note, they're still being used today. You can still end up being prescribed Thorazine. That's still very commonly used today to treat symptoms of schizophrenia. But in the 1990s, we actually got what we call the atypical antipsychotics, the second generation. So the atypical antipsychotics are the newer antipsychotics. They block the dopamine receptors in brain regions associated with psychotic symptoms, instead of that global that the first group had. So they act by impacting both dopamine and serotonin. So you may have heard of some of these. Most common, people hear about things like Zyprexa, Risperdal. Seroquel is a very common one. I've worked with plenty of patients who are taking Seroquel. These are some of your atypical antipsychotics. So these actually had a lot of advantages over the atypical, a lot of advantages over the first generation of antipsychotics. First of all, they're less likely to cause that movement-related side effect. Because they're not blocking the dopamine throughout the whole body and they only impact certain areas of the brain, they actually don't impact the motor skills and they don't cause motor tics. There's far fewer side effects in terms of that. They've also discovered that it can actually work to help treat some of these negative symptoms, that apathy, the withdrawal, the flat affect. These medications can help treat those things as well. And because there are fewer side effects, then people are more likely to take them. So there's actually hope for people to get better because they're more willing to take the medications. Now, that doesn't mean they don't have any issues. They can still produce things like weight gain or cardiac problems, but they actually don't have a lot of those horrible, horrible side effects of the first generation. In terms of their comparison to the older ones, which one's better? They're really about the same. Neither one is greater than the other, but if you look at the side effects or the lack thereof, the atypicals are prescribed far more often because they do lack a lot of those side effects. So, of course, important note, the effectiveness of the antipsychotics is enhanced when patients also go to therapy, whether it be individual or family or even group therapy, and when they get support in having a normal life, in things like education and employment, and when they can have a normal life and see that when I take my medication and I'm not having these psychotic issues, this is what my life can be. And they're more likely to comply with the antipsychotics by taking the medication. There's a greater effect and a greater benefit to them. So some other medications that your book didn't specifically mention, if you've ever heard of Latuda, Zyprexa, I've seen advertisements on TV for Latuda and Zyprexa quite a bit. They are actually atypical antipsychotics. So these are just some medications that you may be able to associate. You may have seen ads on TV. Now you know where it's coming from. Now you know what class of psychotropic medication those come into.